And I told you, ladies and gentlemen, that the focus that we're keeping today on Startup Central is telemedicine. And time now for me to invite my next guest, a former hotshot investment banker at Deutsche Bank, who's now turned an entrepreneur and started a telemedicine startup. Booming business, isn't it? Boasts of a client list that includes the Fortune 100 companies as well as Nifty companies, including pharmaceutical companies. Sanjay Vinayak, the founder and CEO at Connect and Heal, now joining us right here on Startup Central. Sanjay, first off, I hope you and the entire team at Connect and Heal are indeed safe and healthy. A lot of Indians are relying on startups like yours, companies like yours in the business of telemedicine for them to stay safe and healthy. Having said that, tell us a little bit about Connect and Heal. I'm just going by the name. You first connect and then you heal.
That's right, Nayantara. Thank you very much for having me on this show today. I think thanks for the introduction as well. We are indeed all safe here, and my company is basically doing well to keep our patients healthy. And of course, the fight is on. We are called Connect and Heal because when we first came up with the idea, we wanted to basically make sure that we connect as soon as the patient connects with us. We look after the patient till the time we heal him. Over the last 5-10 years, I think people have forgotten the word healing, and it's more curative. We wanted to actually heal the patient. So the fight is on. We are making efforts every day to make sure that our patients are healed. And yes, that's the genesis of the name.
Okay, and now tell me a little bit about the size of your operations. How many cities are you in? Do you have enough doctors, nurses, especially during the lockdown? And are you primarily, catering to corporates? Is that your basic business model?
Nandara, yes. We are largely a B2B enterprise till now. Let me just very quickly tell you what we are. We are a primary care and urgent response company. We are having a complete primary care ecosystem, if you may. We call ourselves the first or one of the few complete O2O service platforms in India, online to offline, which includes telemedicine, ambulance services. We have OPD network clinics across the country. We do occupational health for our large corporates. And of course, we basically are into preventive and curative health screening, and now building up a network for pharmacies as well. So that's basically what we provide as a complete one-stop service to our clients. We are present currently in around 92 cities. We run around 260 occupational health centers. Apart from this, we have a fairly formidable OPD network, which is independent of these corporates. That's around 650 now, and we are counting because as we speak, our team is basically trying to expand this network to serve more and more people. Look, yes, while we are B2B, please do appreciate the fact that once a corporate engages us, he engages us not only for looking after the employees, but also their families. So therefore, we look after the employees and their families, and therefore extremely imperative for us to build a large network across India.
Let me interrupt you there. So let's just to understand it a little better. So let's say I'm an employee at one of the companies Connect and Heal has signed up at, and you've got Fortune 100 companies, Nifty companies as your clients. It's coming up also on the screen. So let's have an employee there. Are you then saying I get access automatically to your doctors, nurses, ambulances, and so does my family?
Right. So depends on what the corporate wants us to do and what is their mandate to us. But yes, we are right now working with corporates to not only look after their employees in their work premises. Of course, at this point in time, most of the factories are closed, but wherever they are on, we are actually looking after their employees right from the time they enter the compound till the time they are basically working in the factory premises. But apart from that, there are companies right now which are completely shut down. There are IT companies which are not working or which are working from home. We're looking after the employees and their families. So let me give you a use case, for example. One of the use cases is that a client has mandated us to look after, to provide telemedicine to the entire families of employees. But in case the employee or any of its family members need us to refer them to a specialist or a physical examination is required in a nearby clinic, then yes, we are basically providing that as and when the need arises for the patient or the families. Does that answer your question, Anthara?
So can I just say that Connect and Heal perhaps is all about bringing the GP back, making the GP more accessible. So I don't have to go to a clinic, I don't have to go to a hospital, just bringing back the whole culture of having a GP.
That's absolutely correct. One of the most important things for any healthcare any healthcare system in the world is to have a very strong primary healthcare and supported by a strong tertiary care, which is largely provided by hospitals. So last 20 years, if you see, we've forgotten the GPs, right? We've basically overbanked upon specialists and tertiary care to provide us primary care. I think this is the time when we need to bring our family doctor back so that preliminary investigations, the basic healthcare can be provided by primary care. And today, I think this is probably one of the best times to illustrate how our hospitals are standing by, so that once my doctors have done the triage and the specialists have done their work, the hospitals are standing by to treat any serious patients if required.
What has the lockdown meant for Connect and Heal? What has it meant for telemedicine startups? This is a time where even the Prime Minister on national television has said, I urge you to not go to hospitals, I urge you to not go to clinics, I urge you not to go in for elective surgeries. After that, we saw the government, in fact, change the regulations for telemedicine, making it feasible, making it practical, making it perhaps a preferred choice. What has the lockdown meant for you?
So the lockdown has actually opened up a lot of opportunities for not just us, but a lot of fellow startups, not just in India, but in other economies as well. I think this is the first time when people have realized that indeed there is an alternative available. Is telemedicine here to stay? Yes, telemedicine is here to stay. But I think what is extremely important is for telemedicine companies like us to provide the right kind of advice, make people comfortable in using this new platform called telemedicine, and ably support this telemedicine platform with an offline system. I think we need to appreciate, all of us need to appreciate, both as providers as well as users, that telemedicine has its limitations, right? So it can do the preliminary work, it can do the triage, that is picking up what the patient requires as the next step, right? Or maybe solve the problem. But in case the problem is not solved, then it has to be backed by a very strong offline system. So therefore, telemedicine combined with a brick and mortar OPD network, for example, is basically here to stay. And I think the work which all startups are doing, not just us.
I have to interrupt you there.
Whether it's a tech
I have to interrupt you there because that. I'm going to interrupt you there because from what you're saying, that would be an ideal situation. Now, that ideal situation, I think, if COVID-19 and lockdown has shown, is not really the case at the moment. So, let me also ask you that in your Connect and Heal operations during lockdown, for example, have you had enough doctors, do you think? Do you think you've had enough support staff? Do you think it has helped take pressure off hospitals and the medical fraternity, which is at the war zone fighting COVID-19? And because I'm sure you've had to perhaps deal with a lot of hypochondriacs or just people scared also right now.
Absolutely. No, Nantara, you bring in actually a very, very important point to highlight. Look, we've all talked about the patients, but I think this is an opportunity for me to clarify that the doctors are actually the ones who are bringing and helping us change people's behavior as well. Let's not forget that telemedicine from an Indian perspective is new for doctors as well. So the best part we've seen over the last 1 month or so, or 40 days since the lockdown has started, is that the doctors are really, really wanting to come forward and take calls in the middle of the night or whatever time of the day. They've forgotten what the time is, they've forgotten the day and the date, and they're basically willing to service our patients. I think that's a very, 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 very strong change in how the doctors. So doctors are absolutely forthcoming. Let's also not forget that we need these doctors safe and healthy as well. So therefore, the more doctors at the primary level take care of our patients through telemedicine, the better it is for the long-term perspective of this disease continuing. And therefore, less pressure on the hospitals. That's what I was meaning to say.
With that, yeah, in fact, they're the real COVID heroes, aren't they? The ones at the war zone fighting COVID-19. With that, Sanjay, I'm going to have to say thank you for joining us. We are out of time. Here's wishing all of you at Connect and Heal all the very best. Please stay safe. Please stay healthy. A lot of people relying on you. A lot of large corporations relying on you. We've had your client list on the screen. Fortune 100 companies, multinational companies, Nifty 50 companies. Thanks a lot for joining us here on this edition of Startup Central. And with that, ladies and gentlemen, we're completely out of time. Many thanks for watching. Be back exactly 24 hours from now. We've got a big guest lined up for you. That's a surprise on Tuesday, 6 p.m. Many thanks for watching.